So our third and final transition for Amanda is age 52. This is the midlife metamorphosis. The emptying time, balancing the needs of self and other. Authenticity comes forward, acting out of your inner integrity, emerging masculinity and power. So Amanda's divorced. Her kids are 16 and 14 and are living with her mostly. She's working again in a very functional real estate office, and she is a real estate broker. Her mom just had a stroke, and she moved her into a nursing home. She has been financially successful since her divorce, and which was 2 years ago, but also it has kicked her into a lot of menopause or perimenopause symptoms, and her periods are very irregular and have finally seemed to have stopped. She's having a lot of hot flashes, night sweats, poor lubrication, and mood swings. She's dating 2 different men who she invites over to her home and has sex with them with the kids while the kids are there, and the kids can hear them. She struggles with how to talk to the kids about sex, but sees that they're experimenting on their own. She doesn't know how not to be a revolving door and set a good role model for a healthy relationship and healthy intimacy for her kids. She's afraid to connect deeper with either of the men she's dating and keeps them both dangling. She's on cholesterol medication, antidepressants, thyroid meds, and considering hormone replacement therapy for sure, because she can't handle her night sweats, which are interfering with her sleep. And she says her kids are really scared of her mood swings. Wow. Okay. Here we go, Dr. Chance.
I could talk about this for hours. I really can. Okay, where do we begin? Entering perimenopause, your estrogen drops, and if you have healthy adrenals, the adrenals are supposed to release a hormone that turns into estrogen, and so your body will have less symptoms. So that's one of the things that I would start off with working with her again. I would work on do an adrenal saliva profile and find out where she is. I would work with her on her diet and her blood sugar. A lot of times women at this age, when they become more masculine or have more masculine symptoms, is because their blood sugar is really high and their testosterone is really high. Okay. Secondly is that when estrogen drops greatly, you have these inflammatory messenger cells that happen in your body, and they go to the different areas of your body that might have been maybe a subtle issue before, maybe a little gastrointestinal, or maybe some arthritis or joint pain. And once estrogen drops and these inflammatory cytokines increase, then your symptoms like brain fog or mood swings or arthritis or GI problems get increased and flared up. So I would find out where her hormones are right now, where she can take a blood test, but I'm more of a fan of hormone saliva tests, which is again one of these panels, and you can do pre-menopause or post-menopause, or you can do it throughout the your life cycle too. So estrogen it's been focused, or menopause has been focused on it as an estrogen deficiency problem. And so even if someone went on hormone replacement, they don't really get to treat the inflammatory process that's going on in their body, and they're not treating the neurological process in their body, they're just treating the hormonal process. Inflammation causes cardiovascular disease, osteoporosis, dementia, Alzheimer's, arthritis, autoimmune diseases, brain function loss, and loss of antioxidants. So that would be something important to work with her. On the third page, I wrote an anti-inflammatory diet that it's just a suggestion. You know, nothing is hard in fact, because everybody is different. Every person's different. But one of the questions that people had asked us at the last meeting was good foods for people in this age group. And I think this is good foods for people in all ages. And I've had people tell me that they've lost weight, that their arthritis is gone, they're sleeping better, their mood swings are better, and they're decreasing the foods that cause inflammation. Now, you might be allergic to something that's on the list that's supposed to be good, and that you should take that out of your diet too. And what I suggest is doing a detox. Sarah Morgan is a nutritionist in my office, and we are on our 4th week of a 5-week detox class The youngest person in the class is 53. There's 4 other women that are in their 60s and that don't know how to eat well. And they're really shocked at how their balance is getting better, their moods are improving, and this is just by eliminating the foods that cause all this inflammation in their body, and then doing some support products that clean out their liver, clean out their kidneys, and trying to get them to sleep better and do food journals and find out how you feel. Today I ate such and such, and this is how I feel. And then we'll reintroduce the foods back in and then have them observe their body and how they feel. So, one of the things I would work with her is preserving her brain function. That's one of the things that are the signs of aging, is the inflammation of the brain. And there are support products you can take that help decrease that dampen the signs of brain aging that we think is, completely normal. And, cellular death of the brain, it happens, but you can dampen that, you can slow it down so you won't have so many aging symptoms. So one of the questions that someone asked is about hormone replacement therapy. There's a gamut of things that you can take that support your body's receptor sites to work better for all the circulating hormones that are in your body. There are things that you can take that replace the hormones in your body. There's bioidenticals, there's compound pharmacies, and then there's the synthetic hormone replacement therapy that studies have shown that have increased cell proliferation, that you're more susceptible for breast cancer and uterine cancers. So I'm going to give you my opinion on all that. See, I'm more in favor of managing the adrenals, managing the food, managing the inflammation, and a lot of symptoms go away. The hot flashes go away, but sometimes people want some more help, so they use the products that help the receptor sites on the ovaries, utilize estrogen better. So if that doesn't work, then I would do more of a sublingual hormone rather than the creams. The creams tend to build up in your system and they don't get filtered out. And a high amount of progesterone or testosterone, whether it's from a cream or from a synthetic hormone, causes your cells to proliferate. And proliferation of the cells, especially the breast and the uterus, you have more of a chance to, just more of a cancer risk for that. So again, I use the diagnostics, and I have a sample of a woman that was on creamed testosterone cream, and I circled all the tests that were out of range, and her testosterone was just, out of range. And I asked her why she was on it, and she said she didn't know. And it also tells you about your risk of breast and uterine cell proliferation and cancers. I'm personally morally against synthetic hormone replacement because they use pregnant mare urine, and I know people that do mare rescue and pony rescue or colt rescues, and it's a shame. I think they don't really do that in the U.S. anymore. They do it in Canada and Mexico. So that's something to look into. You have to know what you're eating and drinking and the pills that you're taking. And if you're taking pills that are pregnant mare urine, I think it's something to be, to know about. So again, looking at her as a whole picture and diagnosing her correctly, and not just doing what everyone else is doing by doing the creams or just taking something that you get at Pharmaca or Vitamin Cottage, finding out what your needs are and working from a more conservative approach, and then being more aggressive if the conservative approach doesn't work. So we can talk about this more if you want to afterwards.